Pareto Health is the manager of the largest employee benefits group captive in the United States. And it's also now the main sponsor of the Self-Funded with Spencer podcast. I chose to partner with Pareto Health for three main reasons. Number one, their dedication to improving the world of health benefits. Number two, their mission to reduce volatility and to make self-funding simple for mid-sized employers. And number three, the strength and scale of their program. With over 2,300 member groups and more than $1 billion of stop-loss premium under management, Pareto Health is the most robust solution of its kind in the country, period. Stay tuned for more information because I'm sure I'll be featuring them on an episode of the podcast very soon. Visit Pareto Health at paretohealth.com or follow them on LinkedIn to stay up to date on the latest news and developments. I'll introduce you now. Brian Whorley is the CEO and founder of Paytient. And Paytient is Paytient, a nice little play on words, and we'll explain why here in a moment. But Brian, welcome to the podcast. Nice to have you, man.
Yeah, thanks, Spencer. It's a pleasure to be here. Thank you very much for hosting me.
My pleasure. And all the way down from beautiful Columbia, Missouri, right home of Mizzou.
That's right.
For those Mizzou Tigers. I went to school in Springfield, Missouri, so we were bonding over the
fact.
So did I. Yeah, you went to, what did you go to, Missouri State, or did you go to Drury?
So I went to high school there.
Oh, you went to high school there. That's right. Good old Kickapoo.
Grew up in Springfield.
Yeah. Well, so tell me a little bit about, before we get into Paytient, and so is the category, is the best descriptor of the category member out-of-pocket financing, or what do you call yourselves?
That's a great question because we're creating the category.
Yeah.
We, on April 2nd, 2018, prior to that, the category really didn't exist.
Yeah.
The need existed, but this category of benefit is sort of new. And so what we're doing is smoothing and removing out-of-pocket costs as a burden or as a barrier in people's lives.
Yeah.
And so we're calling it a health payment account. For sort of lack of a better word. Yeah.
So an HPA, since we love acronyms.
I guess so. World, right? Yeah, I guess so. Maybe we'll come up with something better, or let the market tell us like what it thinks it should be called. But what I like to say is, we're not creating a financial product so much. We're not creating a financial experience. We're creating a feeling. Okay. And what we're giving people is security. Peace of mind and really confidence in the form of a Visa card that employers and others issue to all their health plan members and give them assurance or
I want to dig in that deep right here in a moment, and I do want to go into this deeply because I suspect, since you are sort of this category creator, it's emerging alongside you, and you guys are ones that sort of lit the fire a little bit, that some people are going to be really interested in how this works. And who it's for and all those things. I don't want to miss the story of Brian a little bit because I don't think he woke up all of a sudden and wanted to found Paytient, right? You obviously have a story to tell that led you down this path. And so could you give us really briefly a summary of like educational experience and your work experience? And that'll help give the foundation for the rest of the talk.
Yeah. I'm a builder by nature. So that manifests itself as an engineering degree. So I love building things or creating things and kind of going from 0 to 1. Okay. Or trying to make things that exist a little bit better. And so that's kind of core to my DNA and what I enjoy doing. Was very fortunate to grew up in Springfield, Missouri, went to college in Columbia. It was kind of the perfect size community for me. Ended up working at a hospital there and worked there for the better part of almost 15 years. Wow.
On the administrative side?
Yeah. Okay. Yep. So came in the door actually doing process improvement work. And, there's always something that can be or could be or should be, a little bit better because, every single day I was part of a 2,000 person team, at that hospital who woke up in the morning with one single mission on our mind. And that was, how do we improve the health of the people in the community, in the communities that we serve? Mm-hmm. How do we, when we walk in that door, do we orient ourselves in all the different sort of ways and roles to serve patients, to serve people who are walking in the door and they're in a very personal moment of vulnerability, of need, where, like they're looking for help, to feel better, for themselves or their loved ones. And, I really found a lot of fulfillment, personally in my professional life from that. Okay. And I loved being a part of that team and part of that mission. And really what Paytient is that mission continued. How do we help people more easily and effortlessly access and afford care for themselves and care for their loved ones. That's kind of the grand arc here.
Well, now, I'm curious though, but you being on the administrative side for a decade and a half, did you ever feel were you witnessing certain inefficiencies? Were you witnessing some things that you were frustrated that you felt you were handcuffed and not being able to solve for?
Yeah.
So, because again, this idea was born, I suspect, out of an identification of a lack or a need in the marketplace. So did that discovery process happen while you were in the hospital admin side?
Yeah, I think so. I first, like, there's nowhere or when I would rather be. That if I woke up this morning and had a message from my DPC provider that something was really, really wrong with my health, there's one place that I'd rather be to get care, and that's the United States of America in 2023.
Fair
so
enough.
we can talk all about, hey, how we can be better, but I really sort of root everything around. We really live in a blessed place, and we really have a healthcare system to be proud of, but it certainly can be better, and it should be better, and it could be better, and there's a moral obligation for us wherever we sit in the industry to be working toward better. And so, from inside the hospital, every single person who walks in the door, it's a story, and there's 1,000 decisions that have happened, that they've made or have been made for them, shaping their journey to that very moment, when they've walked in the door. And so all the policies and politics and everything else kind of goes out the window, and we just have to provide great care to that person. But you can't help but think about the plan design choices that the employer have made, or all the sort of influencers or intermediaries before that moment, and think about how could this have gone differently or better, or how could we have put this person or us in a better position to avoid this altogether, or just to provide the absolute very best care in this moment.
Well, and you were saying this over coffee
for them.
Yeah, I was gonna say, you were saying over coffee, at the end of the day, there's a human being standing in front of you.
Yep.
That is in need of some sort, right? Whether that's an emergent need or there's just some sort of issue they're dealing with. That human being is impacted by both sides of the equation and all the things in that chain, the demand side and the supply side chain.
Yeah.
And they're simply there needing care.
Yeah.
Right. And so we don't want to remove the understanding of that.
Yeah. You have to have not just understand, but the very best people I think in our space have a feeling of empathy, where you understand and you empathize with the feelings that they may be feeling in that moment. And you have to then consider and sort of be almost like a zealot, driven to say, how can we make this moment absolutely the best possible moment, considering the circumstances, for that person. And so that's what motivated me every single day of how do we serve others, serve those folks in that moment better.
Okay.
And so, for 15 years, you sort of look and every day just for ways to make it better. Not going to make it perfect, just make it better.
Yeah.
Right. And so that's what we have to root ourselves in. And Paytient really is the manifestation of 12, 13, 14 years worth of experiences, all built into a product into an experience that is designed to enter into the world and to help put people, employers, providers, payers into a better place.
Well,
that's it fundamentally.
Well, so what was the stimulus, or what was the impetus, right, for Paytient? I'm curious. You mentioned earlier that you've always sort of had an entrepreneurial streak, or you like to be tinker, you like to take something from 0 to 1. Was Paytient your first ever endeavor into this notion of entrepreneurship, or did you have other things that you'd done prior?
No, I had it's a great question. A couple times. So I'd always been building, tinkering. Myself and a partner of mine, Daniel Lynn, like back in 2006, 2007, we created just to have a hobby business, just a little nights and weekends project that ended up being in the right place at the right time and probably ahead of its time. So we had created a white label, delivery platform for, third-party restaurant delivery services, so 7 years before DoorDash existed.
Yeah, like an Uber Eats
we created like a platform for a local
So
market.
you had that. So what was it? Can you say what it was called? I don't know if you.
No, we just named it after so the largest oak tree in the state of Missouri.
Okay.
Is along a bike route that I ride around Columbia. And we call it the Big Tree, and so I named it Big Tree.
Big Tree.
And the idea was, 400 years ago, you probably ignored this. And like Lewis and Clark passed by it like when it was 200 years old.
Yeah.
And they probably ignored it, right? And then 200 years later, this thing is still standing and it's significant and provides joy to all these people. And so we just named it that.
That's cool. I like that name.
I did too.
Well, so when you say it's ahead of its time, I don't want to take us too far down that path, but I'm curious.
So someone came along, bought that from us.
Yeah.
Okay.
That
was one thing, led to the next thing. So, and then the idea for Paytient just kind of was like, yeah, go ahead.
No, that's all I was going to say. I was just curious, as you exit that business or whatever, but it's ahead of its time. Does it still find its way? Is it out there somewhere?
Oh, for sure.
With the technology at least? Or?
Yeah, it certainly is. And so now, in 2006, 2007, the idea that, hey, I could order food from a restaurant and have it delivered that doesn't ordinarily deliver, way back in the day. Remember, Spencer, like back in college, it was like Chinese pizza or subs.
I think we could get Jimmy John's. I think getting Jimmy John's, but they deliver it themselves, right? Yeah.
Right. And so that idea was like, I remember friends of mine being like, I wouldn't pay $3 to have this delivered. Well, here, the last few years, like it became commonplace and
COVID, obviously.
Damn near essential.
Yeah, essential.
Right?
Yeah.
Like for that to be, that was just like a part of life.
Yeah.
And so, I think we were super early, and so we were right. We were in the right place. We were right on there. And our bet that we made paid off, right? But we didn't go, I think the lesson learned there was like, we didn't go all in. Like that was just a nights and weekends kind of hobby, like a little software project that kind of caught fire and
that's cool,
ended up taking on. So there was 1 million plus people using that, come 2013, 2014.
That's wild.
Yeah, and someone came along and bought that from us.
Well, cool. So I want to get into the origin story, if you don't mind, of Paytient. Then
Sure.
I think that's a nice segue into that. When was there some sort of aha moment? Was there a series of events? What ultimately led you to go, I think I want to do this?
Yeah. So worked at the hospital forever and ever, like inside the hospital, for a number of years before I really sort of worked on the administrative side. I was buried in an OR, like deep in there. So I wore scrubs every day, and you put your wallet in your locker, and just you walk around with your name badge, and it's probably most hospitals, I guess, would do this, where you would just swipe your name badge in the Starbucks in the lobby or in the cafeteria or in the gift shop and get some mints, and like you would just deduct, like your name badge was your payment badge.
Oh, okay.
So I bet like other employers do the same thing. I don't think that that's like only a healthcare thing, but each time you do it, like it just felt different, like paying like that. You swipe your name badge and that $3 for coffee and bacon would like just come out of your paycheck. You know what I mean? So you wouldn't feel it. And I just recall like, hey, this experience, like, it feels lighter. It feels different. Like it's a different payment experience. Like it feels different. It sounds weird. It does, but
I mean, it's about, I think we use the term frictionless
frictionless.
It's a very frictionless way to pay.
Yeah.
And unfortunately, I have the same experience at Lifetime Fitness. And I say, unfortunately, because we use our app to scan in, and then they have a little cafe but I say unfortunately because it's like
up.
The $12 a day that you don't notice, and you're like, holy cow, how much money am I spending? They made it so frictionless that it's now mindless.
Yeah.
And so it actually is, it ends up being a bad thing. But I can see how that would be a little bit of a light bulb moment for you.
So I'm a slow learner, but with a long attention span, and so like it just took that little experience every day for years and years and years, and so that light bulb just brightened, over time. But But a cool thing you could do is something that we did that was unique for our own folks was, it wasn't just cafeteria, but like if you had a baby, you had any bit of a charge there at the hospital, like, for taking care of stuff, you could spread that out over time. So, and it was just something that was really unique, that we could do. If employees asking to say, hey, can I, spread this out? Can I do $20 of $10 a paycheck for my next 100 paychecks? We're just like, sure, yeah. If that's good for you, it's good for us. It's fine. Like just a little unique benefit that we could do sort of internally for our own people. And
what was like the original thesis, right? If you saw the application for buying food, what was this original thesis of, so as to why, if I could solve this component, if I could make that simple, I think I can solve a big problem in the industry. Like, tell me about that. Like, did you pitch this to a co-founder? Did you have some confidants that you sort of beta tested this in the market as you were sort of formulating this business? I'm curious how that went about. Don't settle for the standard PBM experience. Drive superior outcomes and savings with EHIM, powered by ProCare RX. Their proprietary system allows you to partner with one of the few independent PBMs that owns and manages their pharmacy claims processing platform, providing the savings and connectivity your clients need. With EHIM's proactive approach, custom formularies, and in-network capabilities, groups are given exclusive access to end-to-end solutions that they can count on. EHIM, pharmacy benefits managed.
I think the idea was related to, like, hey, if we can make paying for care effortless, that could potentially bring more folks into the market. Like if we could remove friction, remove pain of paying for care, that may cause folks who were putting off care or avoiding care or getting care and being unable to, fairly reimburse, providers for the work that they're doing. Like, that could make the world better.
Okay.
And so I was biking on the trail with, a gentleman who owns a large FSA company. We were sort of talking about the challenges of related to paying for care, and he had just commented like, Brian, like it's a really, really big problem, and the core of the problem is like there just isn't enough like liquidity that's out there in people's hands. And so I was like, and I still remember it, Spencer, like this is different than a coffee shop, but I remember the moment on that trail where it just sort of was like, if you could bring credit rather than, if those are debit cards and those are, the employer puts on cash or the employee puts on cash, and if there's just not enough cash on those cards, what do we do? Yeah. Like what do you do? And so I was like, what if, so I just thought myself was like, well, what if we actually used credit? Okay. Like if those are the HSA, the FSA, those are debit cards, try to swipe a debit card with $3 on it to pay a $10 thing. Like, it doesn't work. But what if you change those cards into credit cards? And what if we brought that credit to the table? Okay. No risk for the employer, no risk for the provider. Like, we bring dollars to the table, bring liquidity, package it on something that's very familiar that people recognize, a Visa card. That may well solve or at least improve like the pain and the friction and the anxiety of having an underfunded HSA, FSA, or just personal card.
Yeah, and that's what's always been the crux, in my opinion, or the issue over time that I think has been uncovered. Originally, I feel like the notion of healthcare consumerism, it made sense, right? It makes sense on the surface. Hey, let's have the employees share more in the experience and make them better choosers or consumers of care. The real impact has been the delaying of care, or not getting care at all, or making choices to not take their medication. There's all sorts of choices that ended up being, I would say, a secondary effect that have a net negative impact on the healthcare system at large. And so what you're saying is let's actually give them access to liquidity in a way it's interest free, right? To the member as well.
Exactly.
So they don't have to make that decision.
Right.
But so let's talk a little bit about the mechanics, because I don't think we've actually fully described how the patient model works. So can you give me the brass tacks explanation of what you've built?
Yeah. Paytient is a employer or health insurer sponsored payment card or credit card
Okay.
that people can swipe and pay and turn any unexpected out-of-pocket medical, dental, vision, pharmacy, or veterinary expense.
Even a veterinary. Okay.
Yeah, yeah,
Okay.
depending on the employer, like
Yeah.
what they want to provide. Swipe the card, provider's paid. It's just a Visa card, so everybody accepts it. Provider's paid, and then you pick in the app. Gosh, that was a surprise $200 at the urgent care. I'm going to turn that into $20 out of my next 10 checks.
Okay.
Or $40 out of my next 5, or 20 out of my next 10. Like you, the member, are in charge of picking a payment plan that works best for you and your family's budget on a swipe by swipe basis. So we're taking the sting out of the unexpected. We're preserving, protecting any dollars that you may or may not have on in an HSA. You can, and we're giving people essentially time to, more, kind of just provide for themselves and their
Well,
their
so
family
the
members.
alternative options are what? One, don't get the care at all, which
Right.
is what we're trying to solve for.
Correct.
Put it on a credit card with maybe a higher interest
Right.
rate. If it's a truly big amount, maybe I'm getting some sort of really disadvantaged loan, like an auto loan or
you're having to
title loan or something like that, right?
Yeah, maybe engage in an awkward conversation with the provider around like financing options,
Borrow
like,
money from family.
borrow more family,
Yeah,
or
yeah.
like maybe like as providers try to like ask for that up front, like that creates a very sticky experience that providers don't want to be in, and they're just trying to solve for it in their own right.
Okay.
Yeah. So in that moment, like that is a very, very thorny. And so you think about that moment that the folks are in the provider's office, in the hospital, in that setting. That's probably like one of the last things that they want to be thinking about.
Absolutely.
So like stress and anxiety spikes like in that moment. And what we're doing is we're providing means of reducing that spike, reducing that stress, allowing, to take stress out of the system, both for the member and the provider, because they're able to provide care and expect, that they'll be fairly, reimbursed.
Yeah,
for
absolutely.
those
Yeah, I mean,
those
it just,
experiences.
I can see how it would provide, no pun intended, the provider with some confidence as well.
Yeah.
But I want to ask you like about a little bit of the mechanics, you being an engineer. There's a cost to the capital, correct? Right.
sure.
So obviously, by giving it zero interest means nobody can make money on the interest side.
Yeah,
So
we
is the
pay an
employer,
interest, right?
Yeah. So
Right? Yeah.
is the employer funding this through a PEPM model or
Correct.
something? Okay.
Yeah, and we model that and create that in different ways. But traditionally, for employers, it's a sponsored benefit. So the employer pays patient a subscription fee, relevant to, and it's sized to how much credit are we bringing to the table. Are we matching the deductible for everyone? Are we matching the out-of-pocket max? Are we doing something, a different amount that's still meaningful and impactful for your members? And so the employer pays us. Essentially, they're the sponsoring organization.
Okay.
And they provide to us, a census file, and then we avail, this product experience to everybody there that the employer chooses. Employer chooses, hey, gosh, we do want to offer this for any medical, dental, vision, pharmacy, or veterinary expense. The payroll, the people can link. People can repay via payroll deduction. They can link a bank account. They can link a debit card.
Okay.
They can, if they want to repay with tax advantage dollars, like for eligible transactions, like they can link an HSA or an FSA.
Interesting.
So people have essentially in every moment, like every time that there's a swipe, there's a payment, like people have, instead of being in a position of like no choice and having like no voice or choice in what's happening, like we're giving people total voice and total choice. Like we're not only are we putting funds in their purses, pockets, and wallets, but we're giving them like, okay, Spencer, like you're in charge here. Like, how do you want to pay? When do you want to pay? What source of funds is best for you and your family, based on your own, personal
Well, I like
values.
that you mentioned that. I didn't think about it's actually could be complementary to an HSA, so I could see how that works. Let me.
It's absolutely complementary. It's not
Yeah.
competitive. Like we're not trying to replace HSAs. Like they have a role. I have an HSA. You have an HSA. Like they're great. We love them. Like there's a natural partnership with patient HSAs because every time that I swipe my patient card and I pay the provider and then I just say, I'm going to turn that into a painless $10 out of my next 10 checks, and I don't pull that $100 out of my HSA,
Yeah.
I'm just letting that build up and, grow for later in life. Those dollars are invested. And so God forbid, like I need to access that nest egg that for healthcare that I'm growing there, like that's a source for me. But hopefully, I can, with, other means, like just let that grow for later in life.
Yeah.
And, most of the care I experience most of the time in my life, I just use patient to,
Well, I want to talk
make
to
it
you a bit
easy.
about the onboarding process. So you mentioned a census file,
Yeah.
right? Is there an underwriting process at all,
Yeah, so for like really large employers, like where there's different strategies that are being brought to bear, like gosh, we have full-time and part-time contingent, or this is the industry that we're in. We get really, really deep on creating like custom ROI presentations for, if employee retention is very important to that employer. Like, hey, we actually have a great case study and white paper with 4+ years now of data that's statistically significant of how we're able to increase employee retention. We see a difference of a 30% increase of retention
Yeah.
for patient users versus non-users.
so 30% increase in retention?
Yeah,
Okay.
among paper. Yeah, so plus employers 10 to 10,000 plus as a basket. Our data scientists were super proud of this here in the last couple of weeks.
Yeah.
Like, over all these years, we looked at like, okay, folks, and like, what's the turnover retention rate for folks who did not open a patient account? What's the turnover retention sort of behavior for folks who have opened and are using patient? And there's a clear delta.
That's
There's
awesome.
a clear 30% delta. And so for us, like, not only are we creating like a better member experience and taking stress out of people's lives, like that's worth something by itself. But the reality is like, okay, as an employer, as a business, like I'm looking for, a clear ROI here. Like we have limited dollars to invest to create impact in people's lives. Like we need to see some bit of a use case or a business return. Like some employers, that's really important to them. And that's a gate. And so we're able to look at retention. We're able to look at, if migration between low deductible and high deductible is important to them, whether that's organic or inorganic, like we're making a plan design change, or gosh, like we don't want to change our plans, but we would like to see movement between these. We see movement. And so, we have absenteeism, presenteeism, the enrollment by different plan design. Like, gosh, we're making plan design changes, but we want to make that
Yeah.
a little bit more painless.
Well, I suspect
There's
this-
5 or 6 kind of sources of savings.
Okay.
And with every CFO that we've ever sat down with, like they're like, this one's important to me, these aren't. And for someone else, like this one's important to me and these aren't. And so, any one of those is enough of an ROI that they can take to the bank that makes patient, just a high impact, affordable benefit that produces real savings. And then for others who are like, yeah, like all of those matter to me, but what matters most is the ability of our people, for everyone, at both ends of the income spectrum, to be able to effortlessly access care.
Yeah, because there's no discrimination, right? It's not like
Correct.
only a certain income level has access to these funds. Everybody is. Is my understanding correct that everybody on the plan would then have access?
Correct. Every single person has access to it. We do, by law, you have to run just a sense check on ability to repay.
Okay.
And so, what we've done is set those thresholds with our banking partner at a level that ensures that 98% plus can effortlessly get through that. Because we provide enough time, for folks to get through. We don't want folks who are already in harm's way to put themselves into further harm's way.
No,
And so
totally.
just sort of a sense check that, again, we're required to do. But you're absolutely right. And you said you use that you were like discriminate, like in a lot of ways, like we think about, what's the equity like of a health plan? Like, a $2,000 deductible for one person, is a very different barrier, or that feels very different, or maybe inequitable for people at different points of the income spectrum.
Yeah.
And so, in some ways it's almost like regressive in nature,
I can see that.
And so what we're doing in some ways is like trying to level that playing field or right that kind of table and ensure that everybody is at least on a bit more of a same playing field and has liquidity, that they can tap into if they want it, need it, and generally what we find is when people use it once, 85-90% of those folks come back and use it again and again and again. And so it becomes their preferred way to pay for care for themselves and their family members.
Well, I was going to say earlier, and I don't want to lose this thought because I think it is relevant, especially in the world that I swim in a lot, which is the self-funded world, where we're really focused on how do we bring down the cost of care itself, right? Like, and everything else becomes a function of the reduction of costs. What I think, and what I suspect, and I bet you'll be able to prove over time, as you get 8-10 years of data across a million lives or whatever the number may be, 10 million lives, you could probably prove that there was actually a net positive impact on the outcomes of the plan itself by removing that barrier to consumption on the front end. I mean, I
without a doubt,
you share that assumption as well.
Yeah, I do. It's we see it playing out in real life. Like we talked this morning about, what we see and hear every day from members across the country at different, employers, different sizes, from the 10-person employer to the Fortune 500 is putting this in my hand enabled me to pick up this prescription that I previously wouldn't have picked it up. Especially this is a $30 copay. This is a $40 copay that we see the transaction, go and people split that up. So I theorized, before starting a patient and hey, I think that putting this into the world is going to improve the ability to people to access and afford care. I just didn't understand, and I really didn't fully understand how impactful it is.
Yeah.
I whether folks work with us or not, whether people reach out to us or not, I want them to know that this actually does improve people's ability to get care.
We shared with some of the comments, right? I mean, just a steady stream of, oh my gosh, I can't believe I got this. It was I would say, of course you're building a business and you want it to be financially successful.
Yeah.
The reward, I imagine, for you seeing that constant stream of positive feedback has got to go, man, I built something that's changing folks' lives, right?
It is honest to God, improving people's ability. It's creating moments, where those folks who were previously in that provider's office, in a very stressful, anxious moment for themselves or for their loved ones, or they weren't even there to start with, it's allowing people to do the most fundamental thing, which is take care of themselves or take care of the people that they care about. That's a really, really important and impactful thing. And so for us, and for our team, yes, we are building, a viable, an impactful, viable, and, ultimately valuable, business based on the outcome that we're creating.
Yes.
And that outcome is how are we enabling others to live a healthier life? How are we enabling them in a way that captures their heart and mind, that delights them, that enables them to do the right things, which is get, care earlier. Gosh, earlier care tends to be most cost-effective care. And ultimately that is if we can't change if you're not in a position wherever you are in the ecosystem, to change the price of the care, if you're not the seller of care, which sounds weird and even offensive, to think of care being sold, but if you're not setting the price of care, if you're not in that ability to control the actual price of the care, then what this is doing is it's enabling. You're changing the demand or the ability to afford that price, and you're bringing more people to the table. And the beauty of Paytient is we're just doing it in a way that people understand that they love, and it's a super simple experience that also is really, really impactful for folks. And so it's been a great thing. That was the idea to start with. And it turns out that a lot of really, really talented people want to be a part of that.
Yeah.
And so it helps people who,
for a second.
Yeah. They're coming from really, from iconic companies that the name of, who want to come over and they're I want to be a part of making this better. Each person who has come to our team has had personal experiences, or they want to be a part of making this really important part of our lives, healthcare, like better for more people, and almost to the person they bring sort of a servant's mindset.
Yeah.
And that's really helped us to do this. Like I just started the thing. I'm one of 70 now. And so, that's really made our mission possible is those bright minds.
Let me ask you, I don't even want to say a challenging question, but what would you say to folks that might say, well, why this shouldn't be necessary at all? Like, what if I could design a healthcare plan that wouldn't require this? Which is not necessarily a wrong statement, but to counterpoint the notion of this need. What would you kind of say in response, or what is your position on that?
You should do that. You should do that because it is possible.
It is,
It is possible, and it's happening every day. Like, there are really progressive, forward-thinking brokers and companies who are designing health plans where there is no out-of-pocket responsibility, period. You should do that. You should do that, and you should work with any employers there in your community that works for. That does not work for everyone.
For everybody.
Yeah. And so what Paytient is let's make the world as is for patients, for employers, for providers, for insurers or payers or carriers. Like, let's make this better. Like we can look at this, and there's far too many people avoiding care or not getting care, delaying care, deferring care, or just having like a experiencing preventable financial harm. Just given like just as is, and like let's level that up. Okay. And so let's not throw rocks at that or denigrate that or denigrate any one stakeholder that status quo is in any way purposeful or intentional. Like, it's not. Every single person does. I'm of the belief that like everybody who comes into this is really doing it with best intention, and it's just where we are right now. Yeah. And so let's put on our really creative hats and say, well, this is where we are. How do we make this better? Yeah, and I wouldn't disagree with you, right? It's just some of the issues in kind of that plan design model is that it's harder to scale. I wouldn't say it's not scalable, but it's harder to scale. It's easier to do at a very localized level. It's harder to do across the country for everybody and different risk appetites and different situations. But it doesn't mean either one is right and or wrong, right? Where they're just reactions to a need or an opportunity in the marketplace and solving different sides of the equation. That's exactly right. There's some really, really. I actually think like I think this is like almost like a. Renaissance, but like the next 10 years are going to be incredibly fascinating, and the new experiences that are going to come to life with how healthcare is crassly bought and sold. Like, that's not the right way to say that, but the way we insure it, the way we pay for it, the way we access it, the way we understand it, the way we compare it. Like, over the next 10 years, there's going to be wild innovation and improvement, and there's some enabling reasons and legislation and entrepreneurs out there creating that and sort of leading the way and lighting the way. I think that's really, really exciting. Again, and it's exciting because the outcome of all of that hopefully is less just waste broadly in the system, and less wasted humanity. Less, we'll have hopefully the end net result is more people are going to be able to, experience life enhancing care or care that's essential to their life. Absolutely. As a result of all that sort of innovation sort of mixing together and resulting in people being able to satisfy that eternal desire to care for themselves and their family members in a permissionless way.
Yeah.
And
Well, I want to zoom out for it if you don't mind, because I want to talk a little bit. There's two kind of forward-looking questions I have for you. But one is kind of the near and maybe moderate term future of Paytient. Kind of what's on the horizon for you as you evolve this product, and then we'll talk about healthcare in general after that.
yeah, number one, so we've been incredibly privileged. We're in a really, fortunate and privileged position to partner with, some of the most thoughtful companies and partners and payers in the space who are thinking years out of how do they improve their population. How do they improve the health of their population that they serve, be it their employees or health plan members. And so what we need to do, number one, is just continue to serve them at the absolute peak of our ability, and then continually invest in ourselves, both in terms of the talent we bring in on our team, the talent that's already on our team, and the envelope of our product to enable more and more of that population to effortlessly access care, to effortlessly afford care, and then let's lean in and really listen with again sort of a servant mindset to our partners and employers and say, what would be most helpful for you? Like, we have this delightful experience for the out-of-pocket dollar. Like, where can we? What are other ways that we can grow that experience? Like, is it on the in the pocket dollar, or is it sort of continuing our migration as a healthcare company? And I really do feel, Spencer, like we are a healthcare company that just started by helping people to pay for care. And I think ultimately, over the course of the months and years to come, we will become even more of a healthcare platform. Where,
do you
we're
envision
helping
a
people
future where you might actually be a health plan? Or would you want to stay out of the risk-taking business?
I think that there are. I think our end result is the end result that we want to achieve is helping people not just pay for care, but golly, maybe ultimately, for some of our populations we serve, where there are underserved segments of the population, like actually help them buy care. It sounds weird. That sounds weird, but like help people get care, help people, enable people to get care for themselves and their family members in just a frictionless, effortless, permissionless way. That, I think, will always be a desire and always be true. And so the more that we can enable people with an experience that results in that end state, and we change the state of art to that. So, for us, it's going to be enabling people, in the short term to take care of their everyday, healthcare needs. Okay. And I think as we, partner with thoughtful folks and expand that envelope of that curative envelope of what I could sort of get for myself, I think that starts to get even more interesting. But
yeah. Well, so what about the bigger picture of healthcare? And you said something to me over coffee that was kind of an intriguing long-term vision of what you think could happen in the marketplace that I don't think I heard anybody to this point articulate. Because I kind of always ask this question at the end of the podcast is like, what do you think the future of healthcare in the United States looks like? And that's a very broad and vague question, but it's an open-ended question that allows for any possible response. And so you told me you kind of envisioned there might be a morphing of the way that insurance works or catastrophic insurance works.
Yeah, I think any time I'm asked about what does the future look like, I look to history to answer questions about what the future would look like. And I think I look for rhymes or previous societal changes or what's happened in the past to kind of help at least inform what could look like in the future, because I don't think human nature changes. It's always true, and that's what we lean into and try to serve. And so, one huge societal change that happened, decades ago that I don't think will ever go back is we think about, the 50s, 60s, 70s, the expected status quo the mainstream way that people save for retirement was the defined benefit pension plan,
Pensions, yeah,
and so employers, they put money into that pension. Gosh, like the amount of money they had to put into would change based on circumstances outside of their control. Like, what are the future returns of the market, was, life tables, like different things like outside of their control, outside of their core business. In 1978, when the 401k came into being, 12 years later, there were 20 million 401k accounts. Today, vast majority of your listeners and folks probably have 4K, probably don't have a pension. And so like writ large, society changed, a very fundamental way that was, expected, right? And so to think through like, when defined benefit to defined contribution, now we all still have a catastrophic retirement plan, that it's Social Security, like whether you hate it, whether you love it, like it's there, it works. We all pay a few points out of our paycheck into it, employer and employee, like it's there, like, and it, my grandma appreciates that, we all will come to expect that.
But I'm not sure if I appreciate it yet. Well, ask me in 30 years if I appreciate it being there, right?
You're paying into it.
Yeah, I'm paying into it regardless.
Yeah, and so like, and when you think about the kind of Cambrian explosion of like all the financial services and innovation and the Fidelities and all these companies that have grown out to serve that, you know what I mean? Like it's I don't think that we would like box that up and go backward, and employers were like, yeah, I'll take that back on. And so, that played out once, and I think, society, if we all look at it that like, would we go backward? I don't think so. And so I think that you could see that happen for healthcare. In some ways it's already happening, maybe maybe we're slow stepping toward that already, as evidenced by, increases in cost share and whatnot. Like maybe we're slow stepping our way there. Golly, like the catalytic sort of, enabler for that would be, you need some sort of, there's a lot of insecurity in my early life, and the ability for everyone, no matter their personal circumstances, to know that whatever happens in their life, there's cancer, there's any things like to know that that's going to be paid for and covered. Like I think that's a universal. It's a bad word. It's a
I know that's the universal is loaded. Yeah, it's a charge word.
Yeah.
But I mean, it is.
But it's a core.
You would say maybe people would argue a fundamental human right, or a human God-given right. Like I mean, the very basic ability to care for oneself. And be taken care of in the event of something unforeseen or uncontrollable.
Yeah, and so like if the analog is the retirement, and if what happens with healthcare, if what happened with retirement in the way that 160 million Americans plus save for retirement, if we had that analog over here on the healthcare side, and where, golly, we all have a public catastrophic plan, right? And then everything underneath that was, sort of like defined contribution, like, what would that look like? And so Paytient is not a legislative lottery. Like we don't need that outcome to happen in order for us to make a difference. But I do wonder what that would look like then. Like,
well, just being kind of on the inside, understanding a little bit of the stratification of risk, like not to get too technical, but like in stop loss, there's something called sloping, where every time you raise the specific deductible in the stop loss insurance, meaning it goes up, there's a sloping effect which brings down the actual premium that's associated with that. So the more you go up, which is pushing those dollars to the employer, the more that the cost comes down in terms of the premium being paid. So what I've always thought or suspected, which I think is somewhat what you're describing, is what if I had my own individual $25,000 deductible, right? Or broadly speaking, a universal basic spec deductible for everybody. I could see where that actually would reduce the overall cost of insurance.
And maybe you change that as your own risk profile in life changes.
Yeah.
Maybe the 50-year-old Spencer versus the 25-year-old Spencer, you're in a different station in life at that point. Like maybe that changes.
And I could buy my catastrophic deductible down, right?
Yeah.
But there, I get where you're going, and I always question the notion is like, why can't an individual be self-funded, or why can't I get my own specific deductible, right?
Yeah.
I think in theory you could see how having that plus something like Paytient to bridge that gap for the unforeseen expenses, that 1-2 combination might actually be less expensive than buying the insurance from a carrier.
Yeah, it's like things I want to see in the world. It's like I personally, would love to know that every single person, whether you're born into a rich family or poor family, that you don't have to worry about bankruptcy, and that you're going to be able to get good quality care, period. For that you have insurance for what insurance should cover. And then, golly, like, the extent to which we can restore that direct relationship between the doctor and patient, which is really like, that's the most important relationship. Like that's really the only relationship, the only encounter that really matters. Like all this other stuff should be enabling to that. And so the more that we can restore that direct relationship, and where there's an exchange of value between two willing and informed parties, like that's the core of it, and that's what happens throughout our lives. And what Paytient, what I'm really in some ways trying to do is like just to restore that relationship, to bring those parties more effortlessly together, to remove abrasion or friction from that. And we've just been really lucky to work with some really thoughtful employers and payers and others who see that and want to bring that together, and we're always looking for consultants and brokers and those who influence how employers are thinking. Like, if that is important to those folks, like we would love to come alongside them and sit on the same side of the table and try to figure that out.
Well, and I don't doubt it. I mean, I'm not. I don't act in surprise in response to seeing you guys excel, right? Obviously, my organization, I guess I have to say my previous organization now, and you and Paytient have had a long-standing relationship, and I got it immediately when it was described to me. I understood the value that it could deliver. So again, it's no surprise to me to see you guys' success, and obviously some new funding has come in, and so it's going to be fun for me to watch from my vantage point to see how you guys continue to grow and evolve. So closing thoughts, Brian. I know we've probably been speaking for about an hour now, but anything that you want to leave the folks with, whether that's a call to action or just general thoughts of yours as we exit the podcast.
We'd love to come alongside you and your employers and lean in and listen and try to enable an experience where every single person is effortlessly able to access and afford care. It's a super affordable benefit, super simple for employers, super high NPS. People love it. And we can make a difference in people's lives, and we can do that, in partnership with employers and brokers and consultants. I
love it, man. Well, Brian, again, thank you for the travel in. That's fine. I feel like this has been a long time coming because we've spoken on the phone a number of times over the years. And again, I love the solution, and I appreciate you really digging in deep with me here today. And then maybe a couple of years down the line, we'll do this again and talk about some of the additional success. But Brian, thanks again, man. Nice to see you.
Yeah,
nice to meet you.